Welcome and thank you for joining us this afternoon. My name is Sean Evans. I'm with the Meridian Chamber of Commerce, and we are here to share with you our in partnership with the City Meridian, Central District Health, Crush the Curve Idaho, and numerous partner organizations and individuals, the program that will assist Meridian businesses as they reopen amidst the COVID-19 crisis. Our campaign will not only educate businesses on the basic guidelines to reopen based on the Central District Health and CDC guidelines, but it will also allow businesses to demonstrate to the public that they're doing so in a manner that will keep Meridian healthy and open for business. Online and speaking with us today are just a few of our partner organizations that have helped develop this program and to support the Meridian business community, as well as local businesses leading in best practices when it comes to safely reopening. We have Scott Paradis with Central District Health with us, Amy Stahl with Saucer Health, Crush the Curve Idaho. We have Mark Stastny, the Chief Marketing Officer with Scentsy, and Paul Klassen, Vice President of Global Operations with Scentsy, to talk with us today about the specific things they're doing in their organizations deal with the situation. We will open it up for questions at the end of the presentation. The premise behind our campaign was getting businesses back open and restarting our economy. And this is why our group was started. We initially pursued efforts to get everyone open as early as possible. But we also saw the bigger issue of opening amidst the COVID-19 crisis. And that was, will the public return to the stores or establishments when they reopen? We're contacted daily by our business members on how does the governor's plan apply to my business? When can I actually open? And what other guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on the plan or the recommended guidelines, we are here to help Meridian businesses understand them better. The last thing we want to happen for our local businesses is that they go to the effort and expense to open, bring back employees, restock their shelves, and the public, the consumers, not visit their establishments out of the fear or concern for their safety. The Central District Health and the CDC have developed some guidelines to reduce your risk when out in public, and if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public safety and health, then that will build the consumer confidence necessary to restart our economy. The Meridian Chamber of Commerce has launched Keep Meridian Healthy and Open for Business to help our businesses build that consumer confidence. As businesses open, according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars like this one that will provide information from the Central District Health and CDC on basic guidelines for that industry. Webinars also feature local business leaders that have taken even further steps to ensure that they're reopening in a safe, responsible way. After a business participates in the webinar for their industry, they'll be provided free of charge collateral material that they can use in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. This material includes door signage that they can show that they're part of our campaign. It also includes posters for some businesses that need them that display kind of the proper guidelines to be following that they're doing in their store, like enhanced cleaning protocols, 6-foot distancing rules, using touchless payment methods, and just the basic proper respiratory etiquette for when you're in public. It also includes social media materials that you can share to demonstrate that you're a part of the Keep Meridian Healthy and Open for Business campaign. Participating businesses will also be listed on the Chamber's websites for those that are participating in the campaign, so that it encourages people to shop locally and support Meridian businesses. Our program goes beyond what some other business communities are doing by just creating listings that are complying with the guidelines. And this is that the businesses are sharing best practices from other industry-specific leaders. The guidelines out there are not a one-size-fits-all solution for every business. We don't know what we don't know until we start sharing what our best practices are. These industry-specific webinars seek to educate beyond a sheet of written guidelines. Educating businesses on additional protocols that they can implement in their specific type of business is where the value comes in, and we're all here to help each other. To be in compliance with the governor's four-stage plan, businesses will only be provided the collateral materials when their business is scheduled to open according to that plan. Also, following up after opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments from their patrons returning to the stores and businesses. This will assist us in phase 2 of our program as we build out a business revitalization team to support Meridian businesses. Please look to the keepmeridianhealthy.org website for a full schedule of industry-specific webinars coming up. With that, I'd like to turn it over to Scott Paradis with Central District Health to share with you some guidelines that general businesses and maybe our industry-specific businesses that we're talking about today with production, distribution centers, and direct selling may have as far as some basic guidelines from the Central District Health and the CDC. Scott, you want to take it away?
Yes, thank you so much, and thank you for having me. So we have at the Central District Health, we've developed a number of guidelines and processes that we are able to share with everyone for reopening and trying to be safe with re-interacting with the public. So if you were interested, please go to our website at cdh.idaho.gov. We've got a number of different guidelines and guidance documents that are available for everyone to look at for reopening of most any type of establishment that we could think of. So as far as today goes, we have a document that I'll kind of run through and discuss with you quickly that talks about all the different things we feel like should be implemented for reopening establishments and production places of production. So we first thing first, every establishment, every business should have some sort of policy that they develop to cover all the new changes that are going to go into place. And that should be discussed with all the employees and posted in multiple places for every employee to be able to review whenever they need to take a look at it. It should cover all sorts of things like your illness policy. So do not enter the business if you have been feeling sick, if you come into contact with anyone who has been sick at all. Policies that relate to your coughing and sneezing etiquette. So always make sure you cough or sneeze into your elbow instead of into your hands, and then promptly wash your hands right away after it. And just all the new policies, procedures, processes that are going into place in an attempt to fight this virus in your establishment or place of business. Next, you should be having employees do a daily self-check of just how they're doing. So if they are able to, if thermometers are available to each employee, take their temperature every single day to watch out for a temperature that is above 100.3 degrees Fahrenheit. That's the threshold we're kind of looking at for this disease. Have employees also monitor their own health for other symptoms of coronavirus, COVID-19. Look out for fever, muscle aches, headaches, things along those lines. So every day before anyone's coming into the place of work, make sure that they are keeping an eye on just how they're feeling generally. And if they're not feeling well, then don't have them come into work. Next, ensure the availability for proper hygiene for everyone that's coming into work. So one of the most important things we've all heard about is hand washing. So make sure there are multiple locations for employees to do full, thorough hand washing frequently throughout the day. This will mean they need to have access to warm running water, soap, and paper towels, or some other method to dry their hands off. We also recommend that you have several locations that have some sort of alcohol-based hand sanitizer that's at least 60% alcohol. So we recommend having the touchless dispensers. I know they're kind of hard to come by at this point since everyone's looking to get them, but we do recommend some form of hand sanitizers also be available for employees to access frequently throughout the day. And then if employees do have any sort of cough or sneeze going on, I know it's allergy season, so a lot of people are probably coughing and sneezing a lot. As soon as they do any coughing, sneezing, anything like that, to immediately wash their hands. Another thing we're looking for places to be doing is thorough sanitization of everything in the establishment. So before you reopen for anyone to come back to work, we recommend a thorough deep cleaning of pretty much every surface in the entire building. And then once employees do return to work, continued sanitation and cleaning as often as possible. This is mostly focused on the very, very high touch areas like doorknobs, tables, computers, anything like that. So we recommend those get sanitized at the very least every 2 hours, if not even more often, or in between anyone touching the item, then moving on to another item and someone else would come to it. If you are looking for information on disinfectants, the CDC has information about all the disinfectants that are good for different types of establishments. So I would recommend looking at the CDC's website for which disinfectant is proper for your type of establishment. Next, we encourage good safety practices for your employees. Just avoid touching your face, like your nose, mouth, eyes, with unwashed hands. So again, that goes back to what I was saying earlier, wash hands frequently and thoroughly. We encourage separation of people as easily as you are able to with however your facility operates. Keep people at least 6 feet apart. If you are the type of facility that will have customers coming in, again, keep the customers 6 feet apart from anyone. And if you happen to have a line that tends to form at some sort of entryway, we recommend making 6 feet apart tape lines so people know how far apart to stand. And just find any way possible to allow people to continue to stay 6 feet apart or keep their space from each other. If keeping that social distance is not the easiest thing, we also recommend wearing face masks, gloves, and other personal protective equipment just to keep people as safe as possible. And finally, we encourage everyone to use precaution whenever they're doing basically anything. If you happen to have customers coming in that will be doing a lot of payment, we recommend figuring out some sort of online payment system, or having customers who happen to be paying with a credit card insert the card into the machine themselves and run that entire operation by themselves instead of having to pass cards or anything in between multiple people. Any sort of tools that are shared in between multiple employees, have them sanitized and cleaned down in between uses between different people. And we always encourage as much personal protective equipment such as gloves and face masks to be used whenever possible. So that's about it that the Central District Health Department has for this. Like I said, if you're looking for any sort of guidance documents, we have a lot of them available on our website, which is cdh.idaho.gov. Thank you so much for having me for a few minutes.
Thank you, Scott. If you stick around in case we have any questions later, I'd appreciate it.
Absolutely.
Now, while it's not required at this time for employees to return to work, one of the most important factors that's been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk about the availability of the testing in the Treasure Valley is Amy Stahl with Salzer Health and representing Crush the Curve, Idaho. Amy?
Thank you, Sean. I'd like to commend the Chamber for their work on to keep Meridian healthy and open for business. I think that's a valuable public service and educational opportunity for businesses. So congratulations on that effort. I'm speaking to you as the medical partner to Crush the Curve, Idaho. Salzer Health does conduct the testing in the Treasure Valley on behalf of Crush the Curve. So I'll give you a little bit of an overview about the organization Crush the Curve, our attempt for testing, protocol for employers, and additional information about how you can sign your business up and cost. The goal of our organization, we were founded very recently, of course, in conjunction with this pandemic, by a group of very forward-thinking business leaders, innovators, and community civic volunteers who are interested in getting things moving and getting people back to work. The goal is to reduce the spread of COVID-19 through both PCR, nasal swab testing, and IgG antibody testing. So I'll talk first about those PCR nasal tests. We've all seen the pictures of the tests being administered. We currently offer this testing at a drive-up and in a drive-up fashion at the 2 Salter Health Urgent Cares in Nampa, and also a temporary location at the 10 Mile Crossing. The method of testing, as I mentioned, is a nasal swab. It's given to both people who are symptomatic of COVID-19 and asymptomatic people. We share the results with you on a secure patient portal. So as part of this experience, you have the ability to monitor your testing securely in a way that you sign up for yourself. In terms of the antibodies, those tests are administered at the 10 Mile location. We work closely with businesses to help sign up your employees. To do that, we schedule them for appointments. Once again, the results are shared on the secure online portal. It's a very simple blood test that takes a couple minutes, and then results are, the testing is actually sent to the University of Washington, which is a reputable, obviously, organization, FDA approved. Results are returned to you on the secure portal. I should also mention that Crush the Curve is a statewide organization. We're expanding quickly. Currently, we offer testing in Pocatello with, once again, trusted medical partners, Pocatello, Idaho Falls, and Lewiston. There's also testing occurring at other healthcare organizations in the Valley, as well as Valor Health in Emmett. So to conclude, we welcome an opportunity to help businesses get their employees back to work by providing one or both tests at the 10 Mile location. Our staff works directly with you to do the scheduling. The cost is covered by some insurance. We can work with you we will submit those requests, but your business would be responsible for any costs not covered through insurance. The costs are $95 for this is current cost, active virus PCR test, and $105 for the blood draw, and that is per individual. If you're interested in signing up for you or your employees to be tested, there's a form that is available through the crushthecurveidaho.com website, and we will be directly in touch with you from Salter Health. And I look forward to taking your questions later. Thank you.
Thank you, Amy. One of the most important things about our webinars and what we're doing with this program is bringing in our local business leaders to share with you the industry-specific best practices that they have taken in their operations as they're reopening. And joining us today, I have Mark Stastny he's the Chief Marketing Officer of Scentsy. Mark, if you mind sharing with us what Scentsy is doing. You're a global company based here in Meridian and probably have some great things that you're implementing to keep not only your consultants, but your employees and your consumers safe and healthy.
Thanks, Sean. Happy to be here today, and I'm happy to share what we are learning as we are going through this experience, which is certainly unprecedented for us. A little bit about Scentsy. So we operate in the direct selling space, which means we sell our products exclusively through independent business owners, we call them consultants. Some direct selling companies call them distributors. We have about 150,000 consultants, again, who are not employees of Scentsy, but they choose to operate and work businesses on behalf of and or for Scentsy. And they range in, some people work their businesses a few hours a week. Some people literally have quit full-time jobs and work their businesses 100% of the time, and oftentimes other family members that join them in kind of running their businesses. From an employee perspective, we have about 1,000 employees that we operate across all functional areas. We do some of our manufacturing ourselves. We also do work with manufacturing partners, and then we own and run distribution centers where we distribute our products in North America. And then we work with other partners in our international countries to do the distribution. Paul's going to talk a little bit more about that, my colleague, following these remarks. Scentsy actually did not shut down or cease operations. We were actually deemed an essential business in all of the areas that we operate within. But certainly the way that we do business changed pretty dramatically. The 1,000 employees or so that we had, for the most part, with the exception of those employees that Paul's going to talk about in manufacturing and shipping and distribution, all of those employees, probably around the mid-March, third week of March timeframe, were basically sent home. And we were able to very quickly work with our IT department in putting in place ways for them to work at home. I'm not going to talk a lot about the 1,000 employees. Paul's going to talk about our distribution and operations, which I know this call is focused on. I'm actually going to talk specifically about the experience that we've had with our distributors or our consultants. You want to go to the next slide and share with you some of the things that happened there. So as I mentioned, we have 150,000 or so consultants operating in 12 countries across North America, Europe, and then Australia and New Zealand. When it became apparent that COVID-19 was becoming a global pandemic, we were actually in the middle of a roadshow of sorts. We were having a series of events, and these events were oftentimes had consultants coming, not really their customers, but more consultants coming. Some of those events were a couple hundred people. Some of those events were up to 1,200 people in, again, a variety of different locations. We had actually wrapped up all of our events in New Zealand and Australia, but we still had events that we were currently holding and future events planned in the US, in Canada, and in Europe. And so immediately, we basically canceled all of those in-person events, and we implemented a very clear response and communications plans for any incidents of positive tests for events that had recently occurred. Because again, we had been holding events the first couple weeks of March at a time when the virus was starting to spread, but governments really had not cracked down on things outside of China. And so we did have a couple instances of some events in the Midwest in the US and also in Europe, where we actually did have some people who were in attendance at those events test positive. And so we had to put in place very quickly a communications and response plan for how we were going to deal with those instances. And that all actually worked fairly well. Unfortunately for those people that did test positive, immediately self-quarantined, and all of them have recovered. So we didn't have anything more serious than that, but it was certainly the early days when not much was known. We put in that response plan and communications plan in place, which served us pretty well. We also then developed a very clear communications plan for keeping our consultants appropriately informed in what turned out to be a pretty dynamic and shifting environment. We do manufacture a lot of our products here in the US, but we also do have a lot of products that we get, hard goods products that we get from India and from China. And so we were concerned in the early days about supply chain disruption when most of the factories in China were not operating. So we were in constant contact with our partners in China, and we were needing to keep an open line of communication with our consultants, particularly the leaders. The way direct selling companies operate, you have leaders and then you have people that are on their teams. We chose to dramatically over communicate with the leadership within our consultant base, and then appropriately work with them to decide how much we wanted to communicate to the 150,000 or so consultants. And so we over communicated with the leaders, and then we worked closely with the leaders to determine the right level of communication for the broader field. And so far, I would say that has served us well, and we continue to do that ongoing right now. We also immediately encouraged all consultants to operate their businesses completely aligning with CDC guidelines and any orders that were being provided by their relevant government entities across the globe. And we basically told them that Scentsy as a corporate entity was going to be doing the same thing. We basically said, we will continue to operate and serve you consultants as long as we can, but we're going to do everything we can to stay in complete alignment with what the CDC recommendations were and are, as well as any government orders that came down. And for the most part, we have been able to remain operational. All of our employees, minus the ones that Paul is going to talk about in shipping and distribution and manufacturing, were again sent home and have been working from home. Those that are at work, we have put in place very stringent. We closed our campus in Meridian completely to the outside public. And then those employees that do go into the office and or into the distribution centers, manufacturing centers, have some very strict requirements that they operate under, that Paul will talk a little bit following this. Let's go to the next slide. By the way, one thing I would mention on that, to be honest with you, us determining or putting in place the guidance that we would be adhering to and following the government orders really made it easy for us to communicate both to external audiences, the press, external constituencies, but more importantly to our consultants, and basically gave us very clear kind of marching orders that we would then adhere to. So what specifically then did we do? This obviously rocked the world. If you saw the picture on the previous slide, social distancing was not really a big part of Scentsy's world and how consultants operate. They spend a lot of times interacting with people face to face, selling to friends, family members, and hosting parties in homes. There's a lot of person-to-person interaction. We obviously have had, for many years, we've had the ability for consultants to sell online through e-commerce, and we enable them to do that. We have a series of tools and infrastructure that we provide that allows them to easily do that. But a lot of consultants don't choose to do that. They were running their businesses largely in face-to-face manner. Obviously, as the world changed, that was going to change dramatically. So we strongly discourage, keep in mind, these are independent business owners, so we cannot mandate or provide edicts for them like you might an employee, but we strongly encourage, or excuse me, discouraged all in-person selling. So any kind of in-home parties, any kind of people that were selling at fairs and shows or places where there would be public gatherings, we basically strongly discouraged that right from the outset. We strongly encouraged them to shift 100% of their business to e-commerce selling, with direct ships to customers, so they did not have to actually deliver product themselves. And then from a contact perspective with customers, we strongly encourage them to shift to digital contacting and selling using, again, e-commerce platforms that we provide, online parties, phone, text, and email. And for some, that was a stretch. For some, they were already running their business that way. For others, I will be honest with you, it has probably been a healthy thing for them to learn how to operate their business in a more digital savvy world. We then, to help those people, particularly those that weren't already running their business that way, we provided enhanced training on digital and social selling and online parties and helped them up that learning curve. And then hugely important, we maintained Scentsy's consultant support or call center service levels. All of our call center people were actually sent home. We also do allow online chat, but we basically maintained those service levels so that as our consultants were needing help, extra hand holding, or sometimes just a friendly voice to talk to or a person to chat with, we maintained those service levels and invested there pretty heavily to make sure that we were increasing our connection with consultants. And then we also use closed Facebook groups a lot, particularly with that leadership group I talked about before. We've got a series of leadership groups that we operate with. Executives from Scentsy are in those closed Facebook groups every day interacting with consultants as we've gone through this. Results honestly have been remarkable. The consultants' businesses are thriving due to them probably having a little more time on their hand and focusing much more on their businesses and their engagement with their customers. Customers clearly at home and shopping online. We're seeing this in the direct selling world. You're seeing that in the online and the e-commerce world. And so people are still shopping, still spending money, and Scentsy's businesses have actually done quite well. We do sell some products that are in the home cleaning space, the personal care space, soaps, and things that would align very well with the battling against the virus. but a lot of our product lines that don't necessarily fall into those, but actually make the home a little bit nicer place to be, since a lot of time people are spending a lot more hours at home. We are seeing strong product sales across the board, and Scentsy is actually growing quite a bit during this time. We've also seen increasing in people choosing to sign up to become consultants, and we are attributing a lot of that to, one, the consultant engagement and contacting people, but also you have a lot of people out there that have a lot of economic uncertainty in their lives, and direct selling can be an option for them to add some additional income on the side. So that's a quick summary of what we've done, primarily looking at it through the lens of the consultant experience. I'm going to turn the time over to Paul, and Paul's going to talk a little bit about what we did specifically in our distribution centers and maybe a little bit within our manufacturing centers to make sure that our employees were staying safe.
Great, thanks, Mark. Thanks, Sean, again for having us on. We appreciate this opportunity to meet with the community here in Meridian. Yeah, a lot of what I want to focus on and visit with you about today is really the boots on the ground. Unfortunately, those employees who just solely based on job duties or responsibilities don't allow them to be a teleworker or able to work from home. So I want to walk you through the processes that we went through, areas that we're still focusing on, and steps that we're taking to ensure that our employees are coming to work on a daily basis and feel confident and comfortable to be here amidst everything that's going on around them. A key part of that was really creating the mindset at the beginning of this. We started very early in March when everybody was still trying to understand what was going on and what was happening around them. We sat down as a management group and we created a mantra that we as a company and as a department wanted to follow behind it and really help people understand why we're being deemed as essential, what steps were taken to ensure that they can feel confident in the ability to be able to come to work on a day in and day out basis and feel like they're entering a very safe working environment. The mantra that we ended up going with and have been working under comes from an African proverb. It reads, if you want to go fast, go alone. If you want to go far, go together. And that was critical for us. To be able to establish a very transparent communication line with our employees and updating them regularly and appropriately on as things changed within either our business and or the outside world. We wanted to help them understand what those changes meant to them here at work at Scentsy. Very early on, we sat down as a leadership group and we just digest everything we knew about COVID-19, areas where it thrived, how it thrived, areas where it was impacting other companies, global, domestic, local, state, federal-wide. We just started to digest all the information that we could. Then as a leadership group, we sat down and we said, okay, from the time that I enter into this facility, where are these areas that we can understand based on our awareness that we have or understand we have right now? Where do we see COVID-19 really thriving within our facility? And how do we address those concerns? And that's the approach that we took as we mapped out our leveling program. We created a 3-level or a 3-phase escalation program that allowed at each stage to reduce employees' interaction, remove current touch points where viruses is known to thrive, as well as just maintain a scaled level of operation. So in this meeting, we mapped it out. We were able to identify each of those key points. And then from there, we took that and we presented it to the employees. We held conference calls for those off-site locations, and we were able to broadcast through a PA system. Everybody was able to keep their distance, as well as utilize our PA systems here in our local facility. But it was critical for us to ensure that the employees, first of all, knew and understand our sympathy to their position that they were in, and being empathetic to each individual challenges that's going to be coming to them, as each one's going to be very unique to that individual. but yet collectively as a whole, it's having an impact on us all. So through that, we quickly identified that we needed processes in place that softened our attendance policies, also created avenues for those who did have job duties that would allow them to work from home, create paths for them to be able to do so. Again, given the nature of our departments, a majority of our employees to perform their job duties were required to continue to come on site and be here at the distribution centers and manufacturing centers. We identified a program and created a program for those who are at high risk or had family members that needed additional support or caring. That we had a program that we would be able to work with them so that they could appropriately continue to take care of themselves, as well as appropriately take care of their families who may have either at high risk or have other needs. As we saw, a lot of our staff members were impacted as schools and daycares were shut down. We certainly felt that and wanted to be very sympathetic to those conditions around them. I want to walk through our process as we entered into our buildings and the exercises that we went through as we met as a management group, and what was that fallout of those meetings, and what was that plan creation, kind of each step of our process. Each operation is going to be slightly different. We're very grateful and thankful for the CDC guidelines, as well as our state and local guidelines that were provided. They certainly help put framework and structure around the processes that we put in place to ensure that we are creating the most safest and an environment that our employees can feel confident that they can come to on a day in and day out basis and feel like they're working in a safe environment. So right when we went into our review process, we looked at that front door. The biggest thing that we wanted right at the front door, actually, Sean, if we can just go to the next slide real quick, and we'll probably bounce between a couple of slides here. So right when they come into work, this is the first thing that they see. As mentioned by Scott earlier, it's important for us to have a screening process, that being a self-screening, as well as a screening process that we've implemented internally within our departments as well. But right on the front door of all of our facilities, this is the sign that you'll see. We need employees to be aware. We need to educate them on what symptoms to look for, what's that avenue for them to go down if they are feeling unwell, as well as to educate them on how to continue to prevent any spreading of germs. So that was the first thing that we did as we looked at our front doors. We need to educate them even before they enter into our building. If you can jump back up, Sean, that'd be great. Thanks. The next step is they come into our door. We do have a temperature screening. So to coordinate this across all of our shifts, as well as a bit of a uniqueness around different start times and schedules when employees were coming in, we had to do quite a bit of a logistical coordinating within our different team members. But we identified the importance of having additional screening on top of self-screening. We are utilizing a temperature screening process where before each operator comes in and enters into the operating floor, they are temperature screened. Again, just trying to create that confidence that we're taking the adequate steps that we need to have in place to be able to continue to operate in a safe environment for the employees. The next thing that we did on top of this, and this was really for our teams, we created a safety protocol checklist. This safety protocol checklist, this is really our screening process and to develop to create one, to ensure that we are taking the adequate steps that we need, and two, to hold ourselves accountable as a company to our employees that we are continuing to be to ensuring that we have the proper procedures are being followed through with and executed on, and that we're not relaxing as we come into this new norm. So we went through, we created a safety protocol checklist that takes the supervisors. They'll complete this on a per shift basis. Each of these safety steps will be done or reviewed twice per shift. And then it becomes our log that we keep and retain so that we can go through and do an audit. It also helps keep us accountable to ensure that the safety protocols that we put in place continue to meet the standards and the high standards that we as a company want to ensure that we are and are committed to our employees. Within this, so our supervisors will go through, I'll just read you or off a couple of the tasks that the supervisors will be verifying. They're verifying that employees have been monitored for any flu-like symptoms. They're monitoring that social distancing being maintained. They're monitoring that the interior doors are propped open. They're monitoring that all the hand sanitizer stations, disinfectant are all functioning correctly, as well as all of our cleaning procedures are adequate and are being utilized and performed. So on top of this, we also designated, so we have our supervisors that will go through that checklist. We also designated essentially a safety health contact or subject matter expert that will be going through these checklists and performing an audit. Again, for us, it was critical that we don't become comfortable in a new norm, that we continue to hold ourselves accountable to the commitment that we have to our employees. In this, also part of our screening, we did develop a testing positive protocol. In the event of an employee that tests positive, we do have a protocol in place of what that looks like. So we've been able to communicate that clearly to our employees, and they have a clear understanding on what would our steps and procedures be with a deep cleaning sanitization, as well as notifying those who work within close proximity of that employee. We're very fortunate so far that we've not had to use this protocol, but it was important for us to illustrate to our employees and be transparent with them on what this protocol would look like. Moving on into personal protective equipment. We've been very proactive with this, again, as we met as a management group and we're digesting those areas where to thrive and wanted to even elevate and lift our procedures above that, of maybe those being guidelined. We've requested and required all our employees to wear masks and gloves for over a month now. And this is to ensure, again, and install that safety procedure on that. The important part of this that's been critical for us to is establish a very reliable supply chain to ensure that we had adequate product and material available, both in gloves and masks. We were very fortunate to be able to foresee this coming early, that we've been able to establish that supply chain to ensure that we can continue to provide that protective equipment. The other part that was very critical for us to manage the adoption of this, again, we're pushing ourselves to become comfortable while being uncomfortable. And it was important for us to take a very much a top-down approach to this. So consistent throughout all of our operations, whether you're in an office and just working or you're out on the operations floor, I felt it was critical for our employees to see even us as management supporting them in this and wearing masks and protective equipment that was appropriate to the activity that we were doing. And it's really helped them with the adoption of it. It has really helped them to support and see the support that we have for them as well, that everybody is going through this same experience and experiencing some of the same discomfort together as we've gone through this. As we went through that exercise, we identified, first of all, screening, again, with the signage, which was critical, building awareness, education, and usually in all media platforms that we have, whether it be poster board signage, signage on the door, as well as using different medias through television streaming and other slides. We continue to build that education for our employees and really become a new norm for them. We identified social distancing as just an absolute critical piece. And this is an area that we continue to reinforce. We reinforce that in our person-to-person contact. We reinforce that in operational processes and procedures. And we reinforce that in the need of ensuring that we're creating that safe working environment that through the last couple months allowed us to remain open as a central business, but also to keep their safety concerns at the most elevated awareness in our procedures that we're taking. So 6 feet, maintaining separation became critical as we went through our exercise, as we opened the door, as we noticed the personal screening that we needed to do, temperature screening, safety checklist. We then started to look at those points that encouraged congregation. The first point that we noted that encouraged congregation was the time clock. We have a bioreader time clock in all of our facilities. As new shifts began, they would come in and they would gather around that and check in to open this up and to maintain that social distancing. We turned off all of our time clocks. We're now taking a roll call. As employees come in, they go to their stations of work. Our supervisors will then later come through. They'll take a roll call of all those who are on site for the day, and they will be manually or are manually entering their time cards and to, again, help ensure as we start new shifts and end shifts, we're maintaining that social distancing. We literally, myself and as well as other executives, literally walk through each of our facilities with a tape measure. We wanted to ensure that all the areas that may create closeness just solely based on job duties or responsibilities or tasks, that we were able to maintain that adequate social distancing. As we walk through that, we were fortunate that our natural structure supported that 6 feet, but to take added measure and to install added confidence in with our employees, we've installed plexiglass in between workstations, as well as vinyl curtains in areas where employees were working back to back to ensure that they have a safe working environment. To also help us create the adequate social distancing that we felt like was appropriate to continue to meet state, local, and federal CDC guidelines, we created new shifts. We took the same amount of employees that we had on our current shifts, and we split and divided those up into a new shift to ensure that we could right size our facilities to adequately support the number of employees to maintain that safe social distancing. Also, to support that, we added additional breaks and lunches throughout the day. These breaks and lunches allowed us to control the number of employees that would be on site or would be at break during each of those times. And this took a bit of a learning. Even through this process, to encourage it, we would pull out the number of chairs to reduce the people sitting there. We had facilities that even put tape on tables and had them set certain distance apart. And again, just areas where we can continue to reinforce our social distancing was critical to us to continue to install that confidence in our employees that we needed them to feel so they felt safe coming to work on a day-in-and-day basis. Another critical piece that we identified as we went through this exercise was the cleaning, disinfectant, personal hygiene, and sanitation. Our greatest learning curve came to us very quickly is that it's the concept of if they don't see it, it didn't happen. So I encourage you as you go through and you are looking at your sanitation processes to look at and say, how can I make these processes the most visible? And this installed a great amount of confidence in our employees as they could see the steps that we were proactively taking, one from an education standpoint, screening standpoint, but also just from an application of having sanitizers available, the increasing the frequency of our sanitation and cleaning processes, as well as just having general product available for them to use. So to help with this, all internal doors are propped open. So as you come in, the external doors, you'll come in, there'll be a hand sanitization station right there for you to use. And then from there, all of our internal doors, including bathrooms where it's appropriate, all of our doors into our break rooms, offices, and into our open warehouse facility locations, all are open, so to reduce the number of high touch point areas, as well as education on signs. We also encouraged our employees to be self-cleaning. This was important for us to get them on board after they have lunch or breaks, that they are doing their own self-cleaning, and we have product right there available to them. We also have a team that comes in after each break and does a deep clean dive on this, as well as we increased our frequency of our deep cleaning. Actually, if you can go down, Sean, to that last slide that I have in there. Here on the left-hand side, you can see our break room. What we've done to, again, illustrate what has been sanitized and what has been clean, we turn our chairs around. So prior to and after each break, each of these areas and chairs will be wiped down and clean. If the chair is flipped around and face the table backwards, the employees can come in and feel confident that that has been cleaned and sanitized. And then you can see one chair there kind of on the upper left that's facing, the employees will know that that chair hasn't been sanitized and can know to avoid that. You also see that we have several cleaning product readily available throughout the warehouse, throughout the locations, distribution center, but also in our break rooms, so that it's very easy for our employees to be self-managers. On the PPE equipment, we also have clear direction as they come in on the processes that we want them to take, as they put on their gloves first and then they grab their masks. This is just to help us, again, control some of that potential cross-pollination areas, as well as the adequate and appropriate disposal of masks to ensure that items that may have some biomaterial on them are adequately and appropriately being disposed of. We have a process in place where all of our personal workstations are cleaned at the end and beginning of each shift, as well as chairs that are turned around, and just a high importance of cleaning supplies being readily available. And that's been very important for us to have the adoption and support of our employees during this time to be those self-cleaning. You know, it's going to be very interesting as we go through this. We're very well aware of additional testing procedures and more tests becoming available to our employees and to our state, which is a great thing. We operate in 3 different states within here in the U.S., and we feel very fortunate and very blessed to not have anybody that tested positive over the last, well, during this whole pandemic of COVID-19. And we feel and contribute a lot of that results to the proactiveness and the steps that we've taken, the added measures that we've taken as a management team to support guidelines that even go above and beyond those that are recommended. And so we feel very fortunate to be able to be in a position where our employees are able to come to work and feel very confident and feel like they have a very safe working environment. So thank you again, Sean. We appreciate the opportunity to come on and discuss our learnings as well as the best practices that we've implemented.
Paul, thank you very much. Very complete presentation. You brought up some things that we hadn't even thought of, and that I think a lot of businesses are really going to be able to appreciate and understand. I mean, turning the chair around, what an ingenious way of designating whether or not that space has been cleaned or not. So thank you so much for sharing with us. With that, I'd like to open it up for questions. We do have a few minutes left, but I think with the complete presentation that you made, we may not have very many. If you want to enter your question in the chat or the question area, please do so. As I wait to see if questions come available, just a reminder that this presentation has been recorded and will be made available on the Chamber's website and the Keep Meridian Healthy and Open for Business website. And that is keepmeridianhealthy.org. We appreciate everyone that's joined us today to talk about production distribution centers and the steps that they can take and best practices to make everyone feel safe and healthy. Still don't see any questions, so with that, I'd like to just wrap up and thank all of our participants again, our panelists. Scott Paradis from Central District Health, Amy Stahl with Salter Health and Crush the Curve, Mark Stastny with Scentsy, and Paul Klassen with Scentsy. Thank you all for participating today, and y'all have a wonderful weekend and a happy Mother's Day. Thank you.
Thanks, Don.
Thank you.